life and takes you far. Tune in to talk for health that's gold. Aarogya story waiting to be told. Good afternoon to one and all. I am Shivani Kush from the Office of Academic Outreach and New Initiatives. It is my pleasure to welcome you all to the 6th session of the Aarogya Health Talk Series, an initiative by the IIT Delhi Hospital and the Office of Academic Outreach and New Initiatives, aimed at healthcare awareness and meaningful dialogues around real-world medical issues. Each session of this series is designed to provide practical, evidence-based insights from leading medical professionals, helping our community better understand and manage health challenges. Today's session explores a unique and critical subject, brain health. Read a book, jog a mile, keep your brain sharp with a smile. Think it's bright, stress away, happy mind will light your day. Through this talk, we will discover how to protect, improve, and optimize the brain so we can lead healthier, happier, and more productive life. We are honored to welcome a distinguished speaker today, Dr. Manjiri Tripathi, who is the head of neurology at AIIMS, New Delhi. She completed her training in neurology at IIMS, Bangalore in the year 1996. She worked as a faculty in the Department of Neurology at St. John's Medical College, Bangalore from 1997 to 1998. She joined AIIMS as assistant professor in neurology in 1998. She is a member of professional societies like American Academy of Neurology, Indian Epilepsy Society and Association, National Epilepsy and Disability Work Group. Her main areas of interest are epilepsy, especially intractable epilepsies, women with epilepsy and fundamental microimagining in epilepsy. She is also interested in the use and programming of implantable devices in epilepsy. Her other areas of interest are cognitive disorders, especially dementias, childhood acquired aphasia, sleep medicine, and tropical neurology. To formally introduce our esteemed speaker, I now invite Dr. Mahesh Sagar, head of IIT Delhi Hospital Services, who has played a key role in strengthening campus healthcare and guiding his Health Talk series through inception. Please join me in welcoming Dr. Sagar with a round of applause.
Good afternoon, esteemed faculty members, staff, and other participants. It's my great honor and pleasure to extend a very warm welcome to all of you to this highly anticipated Health Talk session on brain health. In a world where our well-being is paramount, understanding and caring for our brain, the very command center of our existence, is not just important, it is essential. Today we are privileged to have with us a speaker who is not just an expert, but a veritable luminary in the field of neurology. It's my distinct privilege to introduce our distinguished speaker for today, Dr. Manjiri Tripathi, Professor and Head of Department of Neurology at AIIMS, New Delhi. Her academic journey began with an MBBS from MKCG Medical College, Odisha, MD Medicine from IIMS BHU, Varanasi, DM in Neurology from prestigious NIMHANS, Bengaluru in 1996. After a foundational period at St. John's Medical College, Bangalore, Dr. Tripathi had pursued advanced fellowships in epilepsy and sleep medicine from leading international institutions, including the University of California, LA, Wake Forest University, Northwestern University, Chicago, Columbia University, and Royal College of Physicians of Edinburgh. Her main area of clinical and research interests are both deep and transformative, focusing on intractable epilepsies, women with epilepsy, functional neuroimaging, and the use of implantable devices. She is also deeply involved in cognitive disorders, dementias, and sleep medicine. As an integral part of the comprehensive epilepsy care program and the core member behind India's epilepsy treatment guidelines, G-MIND, which stands for Guidelines for Epilepsy Management in India, her work directly shapes national standards of care. For over 23 years at AIIMS, she has been the guiding force for countless DM neurology students, PhD scholars, and MBBS and nursing professionals, shaping the future of neurology in India. Her research output is nothing short of phenomenal. With 351 full-length original articles in indexed high-impact journals like the New England Journal of Medicine, Lancet, and JAMA Neurology, the shelves of accolades she has received are a testament to her impact, from the AAPIOS Best Sleep Researcher Award and the BMJ Best Paper Award to the AIIMS Best Research Award, and an extraordinary contribution to Epilepsy Award at Asian and Oceania Epilepsy Congress. Her expertise is sought globally, having conducted grand rounds at institutions like UCLA and serving as a visiting professor in Germany, Indonesia, and Morocco. Beyond the ivory towers of academia and research, Dr. Tripathi's influence is deeply felt in public health and policy. She is in charge of Center of Excellence for Epilepsy and serves as a key advisor to the Ministry of Health, the National Health System Resources Center, and the ICMR. Her heart, however, beats strongest for community outreach through the initiatives like Ekatvam, which provides free medicine and epilepsy surgery to the underprivileged. Her work with Alzheimer's and related disorders, Disorder Society of India further showcases her profound commitment to patient care. Today, she is here to share her invaluable insight with all of us on the crucial topic of brain health. Ladies and gentlemen, we are truly in the presence of a master of her craft. It is now my immense pleasure to invite Dr. Manjiri Tripathi to the podium to deliver her health talk. Dr. Manjiri Tripathi.
Thank you for the very generous introduction, and it's good to see many youngsters here. So just to get a feel of the audience, how many of you all are students? Okay, very good. And how many of you all are caregivers or relatives of students? Okay, not many. And how many of you all are teachers? Okay, good. So mostly students, so I think it's good if I cover it in a way which is going to at least influence them, and the key word nowadays is influencer. So I do not have any disclosures, except whatever I speak here for brain health is work in progress on myself also. So I would not like to say I'm doing everything perfect for my brain health. But every time I give this talk, which is why I like to give this talk, is that repetition of what brain health is also helps me improve my own brain health. So that's the only disclosure that I have. You see, the brain is probably an organ of which we know very, very little. In fact, what we know about the brain is far less than what we know about any other organ in the body. And there are areas in the brain which we really don't know what they're doing, but I suppose they're doing very important things which we will eventually discover through bright minds. Now, the human brain is something which helps us differentiate our actions and behavior and the processes which we have in day-to-day life from our nearest counterpart, which is monkeys. So we do have a brain which differentiates us from monkeys, and which is a key part of the brain which helps us be different from our, maybe predecessors or whatever you may call them, is the frontal lobes, which is in the front of the brain. So the blue area, the vast blue area which you see on the slide here is the frontal lobe. This frontal lobe is the most beautiful lobe of the brain because it helps us in social cognition. It helps us in, having an insight, perception. It helps us in judging, in abstraction, in comparing, in set shifting, multitasking, short-term, immediate working memory, and it has many such functions. So this frontal lobe is basically what is making us sit quietly and listen to this talk without having a reduced attention span, without being impulsive, and has also made us dress appropriately and come for this meeting and not shabbily or not, just getting up from the bed and coming here. So this is the part of the brain which makes us very, very human. And then we shift to another part, which is marked in green, which is the temporal lobe. Now, the temporal lobe, the deeper structures, they are the emotional brain, and they are the very ancient part of the brain, which is what we know as a limbic lobe. The limbic lobe is a very, very kind of brain, which is there probably in the reptiles as well as the lower species also. And this is a very emotional part of the brain. It also deals with a lot of responses to fear, and also it has a lot of autonomic functions in terms of sympathetic, parasympathetic, and memory functions. So that is the limbic brain. And then you have the neocortical temporal lobe, which is marked in green, which also serves a lot of function, particularly the upper part of which is responsible for our hearing. And then you have, the junction over here. This junction which you see here is also very important. It coordinates a lot of functions, including calculations, dressing, writing, reading, etc. all come to this part. Reading, of course, is along with the occipital lobe, which deals with the vision, visual perception. And then there's this parietal lobe. We know very little of it, but most of it is dealing with sensations in the body, perception of the body, the sense of self, and visuospatial direction sense, where you're going, how you're going. And then in the inner side of the brain, you have the cingulate cortex, and you have different parts. I mean, if I start naming them, my whole talk will consist only of the parts of the brain. Now, it's very important for us to understand that if anything happens to any of these parts, it is practically going to be irreplaceable. Once the neurons die, they die. Once we lose neurons, we lose them. So the only way to look after this precious organ is to understand about brain health, do research on brain health. And this research need not be confined to labs. This research can be wonderful social as well as scientific research, as is being done worldwide. So what we see as doctors is only the upper part of, say, usually you say tip of the iceberg, but here you're seeing a tree. So when you see a tree, you actually don't see the roots. Similarly, if you have an analogy of the tree to the various diseases that we have, whether it's cancer, whether it's skin disease, whether it's mental health, whether it's gastrointestinal disease. So the part which we see, the diseases which we see, in the hospital, in the clinics, are this part of the tree, the visible part of the tree. What is the invisible part of this tree? What gives this tree strength? The roots. So we do not see the roots. We do not understand the roots till it's too late. And these roots are actually very, very basic human needs, very, very basic human functions, very, very basic chronological rhythms of the body. In olden days when there was no electricity, people used to rise by sunrise and sleep by sunset. Even today, if you have farmers who are working in the fields, they will rise at 4 or 5 whenever the sun rises, depending on whether it's summer or winter, and they will sleep early and again rise early. So this root where probably all diseases originate and become very, very complex is the very basic needs of us as human, as biological species. Whether it is nutrition, whether it's sleep, whether it's lack of exercise, whether it's trauma. Now, trauma can be, or stress can be of various kinds. It can be physical stress, physical trauma. It can be emotional stress, emotional trauma. So it can be of various kinds. You don't necessarily have to have a head injury to have a disease. Repeated emotional trauma itself can lead to diseases, as research has found. So these are the roots, and unless you nourish these roots, you will not be able to get a good visible tree with green leaves and fruits to bear. And that is what this talk is about. So basically health, in which case, which we are talking about here, which generally they say is, have an apple a day and keep the doctor away, is brain health. Now, from health, we are shifting to brain health. And we are going to look at, the basic 3 things, which are the fundamental pillars of brain health. And we'll go along it. So what do you all think are the fundamental pillars for brain health for all of us? I mean, you can just randomly guess. Anyone wants to guess? Very good. 1 is sleep. Second? Just 3. There are many. Diet, nutrition. Okay, so sleep, nutrition. Third? Diet, nutrition, diet, okay. Exercise. So sleep, exercise, nutrition. These are the 3 fundamentals of having a good brain health. They are mentioned there to a certain extent, and we can add another S, which is stress. So let's go through what is the evidence and how can I as a neurologist provide, guidelines or kind of guidance or kind of help in your reducing this, particularly as I come to the clinic every Tuesday. I find a lot of students coming in with headaches and stress-related issues. So it's a major chunk of the clinic which I do here. So once you know that these are probably causing a lot of deterioration in brain health, you can simply work on your brain health by these, the triology or the, whatever, the 3 circles intersecting each other, by improving our reserve, or brain reserve or cognitive reserve or whatever you call it. Each one of us has a different reserve, and it depends on many, many things. It depends on how well educated we are, and hopefully we all are quite educated because we found our way over here. It depends on repetitive cognitive training on certain tasks which you do. It depends as you age with hearing. Many elderly people, their cognition or brain health deteriorates because their hearing is deteriorated and they aren't using help for their hearing and not hearing well. Then, of course, look at this part of it, which is social network and depression or loneliness. And this is some area which is gaining lot of, traction in cognitive brain reserve preservation, is how networked you are socially, not just your work and back home, but just a positive interaction within your community, within your society, whether it is doing a little task of, say, setting up this auditorium when somebody is coming here to give a talk, or whether it is during a festival arranging things in your hostel or something like that. But it has to be a positive social network. And loneliness. Of course, this is a huge problem now. We are finding this as a huge risk in elderly who undergo a cognitive decline, because many of the children are outside the country and the elderly are in India. They're left alone. And there is no means and guidance as to what they should be doing to prevent the depression and ensuing cognitive decline. And then you have this exercise, which forms a big chunk, which is joining these 3 circles. Now, this circle, which is very, very preventable, is treatment of diabetes, hypertension, and lipids. Now, how many of you here who are above the age of 35 have actually got your blood pressure measured at any point of time? Okay, 1. How many of you have actually got your baseline sugars done? Above 35, I'm not talking below that. Very few, but more than the blood pressure. And how many of you all have had your lipid profile done above 35? That's more than. So blood pressure was the least, followed by the sugar, followed by the lipid profile. So I can gather that it's more difficult to measure the blood pressure than the blood test, because they are easily mechanically done by a lab. Now, what if I told you that actually your blood pressures need to be measured after 35 at least once a month? Okay, we look at our face in the mirror daily. We brush our teeth daily. But we do not see our blood pressures after 35 at least once a month. This is a must, because you're finding many, many young people having hypertension. And hypertension is a huge risk factor for brain health. So above 35, at least once a month, and I think almost all families will have at least one blood pressure instrument at home. This is what, at least in my house, there's not one, but there are actually 3 blood pressure instruments, because I have 2 sets of parents and then ourselves. So you will have at least one blood pressure instrument, and they're so easy to use nowadays, and very well standardized systems are available. So this shouldn't be difficult at all. Now, what if I told you that many of us are walking around with low blood pressures, below 110/70? So one is to have high blood pressure, which itself is a risk factor for brain health. The other is to have low blood pressures, okay? So I had a patient who came to me, she was a young, very beautiful girl. She said, "Madam, I'm having headaches daily. Every day I'm having headaches. And this is going on for 3 months. I've tried 20 medicines, it's not working." So I said, "What is your usual diet?" She said, "Madam, I take beetroot juice daily." So some Ayurvedic, dietitian or whatever has told her, you have to take beetroot juice, it's very good for your brain. So do you know what beetroot juice does to your blood pressure? It drops your blood pressures because of the nitric oxide in it. So it's going to drastically drop your blood pressures. And when I measured her blood pressure, it was 70/30. So if you're roaming around with blood pressure, so it's not just high blood pressure, if you're roaming around with blood pressures which are less than 110/70, you're going to have headaches, you're going to have back, shoulder, which is known as coat hanger pain, and you're going to have them daily, and you're going to feel tired, and you're going, that's going to impact your brain health also, and you'll have watershed infarcts if it goes on and on. So it's not just high blood pressure, it's also low blood pressure. So please try to note your blood pressures after 35. That preserves brain health. Then, of course, smoking is a big risk factor, and this is really troublesome for us because somehow smoking is seen as something very, hep to do. And unfortunately, fortunately, I stay in Gurgaon, and my house is just opposite the Google building. And in the morning when I'm coming to AIIMS at 7:30, I find these young girls standing with their, the slim cigarettes and smoking. They've just finished their work shift or they're going home. They've done their night BPO, whatever, conversing with the Americans. So they are happily smoking. And it's really painful to see because we know the impact of smoking is there on everybody, but more so in women. And we find more and more women, at least in our society, at least in Delhi, picking up smoking. So little do they understand that it is going to predispose them to strokes, it is going to predispose them to dementia, if they don't suffer from malignancy before that. Then, of course, obesity. Obesity is something which is very prevalent if you are sedentary or your diet is messed up, full of carbs or fats. And this is something, again, which we need to work with along with exercise. Then, of course, you have diets which promote inflammation. There are certain diets which cause so much of leakage of fluids, leakage of cytokines as we consume them. And any guesses what these diets are? Which are the pro-inflammatory diets? Sugar is one, very good. You'll be able to answer everything. Highly refined flour, which is your maida. Then whatever is made out of maida, which is pasta, noodles, okay. Then oily food, which is made from not just any oil, but super saturated oils or oils which have been burnt and reburnt. So the oil which we, when we eat outside, they fry the samosas and they refry again the second set in the same oil, then the third set. And the oil which is left, because it's such a huge kadhai they're making it in, they're not going to throw away that oil. They're going to keep it and use it the next day. So it's reheated again and again, and it is a very inflammatory substance. Not only is it inflammatory, it's also a carcinogenic substance. So both cancer as well as your inflammation, brain inflammation is promoted by these substances. Now, it has been identified, not by me, but all the neurologists and psychiatrists who deal with cognitive health and brain preservation, that along your life course, from the day you're born to the day you age and become, say, 70 or 80, there are various preventable things. So, of course, you cannot change your genes. Okay, you have the ApoE4 gene, you're more likely to have cognitive decline. But if you have attained good education, then you have prevented brain loss by about 8%. In the midlife, if you've corrected hypertension, diabetes, obesity, then it's going to prevent it by 9 to around 1%. And in the late life, if you have stopped, all these things, you become physically active, and you have been physically active, you are socially active in a positive way, you've controlled your diabetes, and you're not depressed, you're going to prevent cognitive decline to a huge amount. So the conclusion of this landmark paper in the Lancet was that 35% of your cognitive aging or brain aging is preventable. Okay, and you can stave off, or you can change the life course by acting on it early in life, in midlife, as well as along your whole lifespan. Hence, it would be good to say that all of us should be very, very ambitious about prevention. If you have to be ambitious, one is, of course, you be ambitious to achieve your targets, whether it's research, whether it's your job or salary package or whatever. But more than that, you can work and you can do all that if you can prevent brain disease. And 35% of dementia can be prevented by these things which I showed you along the life span of your life. And it's basically, all this evidence comes from large scale, thousands of patients, observational studies, whether it's the Framingham cohort or it's the Rotterdam cohort. Now, have you all heard of cognitive reserve? How many of you all have heard of cognitive reserve? Now, cognitive reserve is something which, again, a lot of it is modifiable to preserve brain health. And these are the factors which are there in cognitive reserve, some of which we don't have control over. Brain volume. Many of us do not have control over our brain size. Some of our heads are large, our brains are big, some of the heads are small, the brains are small. But brain volume can be artificially influenced by which toxin? Which toxin causes massive shrinkage of the brain? Can you answer? Alcohol. Alcohol is now, we don't call it a recreational agent. It's even a single drop of alcohol is designated a toxin by WHO now. So what does alcohol do to your brain? Even consuming, say 10 ml or 15 ml of alcohol daily, and if you're doing it for 10 years, your brain is going to be shrunken by around 30%. You're losing brain volume if you're consuming alcohol. So for brain health, again, removing alcohol is very, very important. Then, of course, before you became sick, what was your intelligence? If you were highly intelligent, there's more chance that you have a good cognitive reserve. Then the education. If you're highly educated, you're having more cognitive reserve. The less incapacitated you will be in case you have neuronal loss due to aging brain. Occupation. The more fine your occupation is, the more challenging your occupation is, either mentally or in fine tasks, whether you are making fine instruments, you're playing fine instruments as a musician, or you're a dancer, you are preserving your cognitive reserve. Physical exercise is something which really preserves cognitive reserve, as well as cognitively stimulating activities. So cognitively stimulating activities could be different for different people. And most of what we advise is Sudoku, puzzles, painting, then Scrabble, and chess. These are all highly cognitively stimulating activities. They all work on to preserve your brain functions. And this is not just been shown by, theoretical studies, but it has been shown that they develop dementia. If you have a higher cognitive reserve on all these factors, you are less likely to develop dementia, and you are less likely to, have low tolerance to neuropathology, which damages the brain. So as I told you, our endeavor is to save the brain, and hence we should work on blood pressure, the mood, stay positive, remove depression, remove loneliness by whatever method, physical exercise, diabetes, control heart disease if you have it, And do cognitively stimulating activities. Your diet should be good. Avoid drinking, avoid smoking, and take care of your kidneys by enough fluid intake. I speak to youngsters who come to the clinic, and sometimes I ask them, how much water are you taking? And they say, I'll take 2 glasses in a day, and that's not enough. At least in Delhi winter, 2.5 liters, and in summer at least 3 liters. Because hydration can prevent sluggish blood flow. It will prevent blood clots. Another thing I see nowadays is youngsters going to gym. When they go to gym, they are told to consume protein powders, and one does not have knowledge as to what has gone in that protein powder. Now, when they're consuming this protein powder, which is consumed and taken, the blood viscosity thickens. And when your blood becomes thicker and more viscous, it becomes more sluggish in flow. And that is why we are seeing young strokes. We are seeing people go to the gym and have a brain stroke at the age of 30. We are seeing people go to the gym and have a heart attack because they haven't hydrated themselves. They are taking these super proteins which have caused sluggish blood flow. Plus, they're exercising and putting their body at stress where the heart rate is doubling or tripling when they're doing their exercise. So you'll find every month or every once in 2 months a news item, that fellow died in the gym, fellow died here, fellow died there, and he was young. So these are something we really need to work at. This is just a daycare center for dementia patients. And you can see we try to make them do simple tasks with the limited resources which are there, including engaging in, these are all mild to moderate dementia, so engaging in cognitively stimulating tasks, reading, doing puzzles, etc. So whatever increases the risk of, permanently damaging your brain health, that is something we should be aware of. And really, you don't have to start saying, I will not do this, I will not do it. You just be aware, okay, that this is a risk. Once you're aware, you've covered 70% of the distance, you automatically will start avoiding. Once you're aware that smoking can cause stroke, once you're aware that smoking can cause dementia, you just have to see a person smoking and you have to think, oh, stroke and dementia. So you may be a smoker yourself, but subconsciously you will reduce the number of cigarettes you're taking by just being aware. So 70% of it is just creating awareness, which is what this talk is doing. Believe me, the first risk factor study for India and at least major part of the world was ours, where we looked at the risk factor in a case control manner. And this was the first time that we documented that there are certain preventive factors in our population. And we got the same. We got diabetes, depression, hyperhomocystinemia, hyperlipidemia, ApoE4 gene, pickles, because many of our families, they take pickles. And what do pickles have? Pickles have oil and they have salt. That's the common thing. So what does salt do? Salt will push up your blood pressures, and the oil, particularly if you're purchasing the pickle from the market, you really don't know what oil is going into it. So if you really have to have pickles, make in small quantities in your home with limited salt and oil, which you know what you're putting. If you know it's sesame oil, you bought the sesame oil and put it. Okay, if you know it's mustard oil, you bought the mustard oil, you know what value of oil you bought and you put it. So the market pickles, you really don't know how much salt, and invariably the salt will be very high because they are on the shelves for long. And there will also be a lot of oil. So we showed that pickles also were a risk factor for cognitive decline. Urban living like ours was also a risk factor. The rural patients, rural people didn't have so much, and lack of exercise. We found living in joint families, active socialization, and participation in cognitively stimulating activities, intake of PUFAs, fruits and salads and sprouts, to be preventive. Now, this was probably the first study way before, 14 years before the Lancet Commission report. The other thing which affects brain health is, of course, air pollution. And this is something where we really can't do anything about it in a city like Delhi. There are times in October, November, where we gear up for pollution, and this goes on till, say, January. And it's a recurrent event year after year. And we know that this is a huge risk factor because when we are exposed to pollution, which is so ubiquitously distributed in the air, we are like smoking 20 cigarettes a day without actually smoking those cigarettes. So when there's pollution in the atmosphere, I stop telling my patients to smoke because I say, hum sab smoke kar rahe hain. So it is something which we need to work as a community of educated people. There should be many more public interest litigations in the court against, I should not say I'm a government employee, but control measures. So fortunately, I was also in, Global Action Against Dementia Consortium, and we looked at the various factors along with the G8, and you can see here, we gave a summary statement, a kind of white paper which was published in Journal of Alzheimer's Disease. We said sufficient political will is required to facilitate these factors for promoting brain health and preventing dementia. And we were 108 neurologists and psychiatrists across the globe. So this is a card I give all my patients. This card sums up pretty much what I've been talking about. Hearing aids, improve education, smoking, depression, physical activity, blood pressure, traumatic brain injury. Now, traumatic brain injury, you can understand which kind of traumatic brain injury can cause dementia or neuronal loss. Have you all seen the movie Concussion? How many of you all have seen the movie Concussion? Nobody. So I recommend after this, please go and see the movie Concussion. It's very interesting. It's about American football. And their football and their maneuvers which they engage in football involves a lot of head hitting. And this repeated head hitting causes neuronal loss. It causes small superficial bleeds on the surface of the brain. And it causes accelerated traumatic brain injury, as well as it causes dementia. It is well established now. It is one of the occupational hazards of playing this game. So any of you who are doing sports where there's repeated knocking on the head, similarly, we all know about the famous boxer. Who's the famous boxer who developed Parkinson's disease? Yes. So the repeated, knocks on the head will give rise to even Parkinson's disease is a proven thing. So you have to engage less in those sports, or you have to have some protection against injury in those sports, because repeated head injury or repeated knocks on the head are a very important cause of cognitive decline or Parkinson's disease at late age. Social isolation, air pollution, alcohol, obesity, etc. all I've told you. And then the preventive factors, which we'll come to. Stay sharp, your diet, and social. So very often I get asked, when should we start this? When do we start aging? When do we start aging? On the day we are born. On the day we are born, we start aging. So, and when do we get the first droplets of cholesterol in our arteries? When do they start depositing? By the age of 7 or 8. Okay, all that ghee laddus and this and that. It forms small cholesterol droplets in your vessels. So we start aging from the day we are born. We start having cholesterol deposits in our vessels from a very, very young age, even before the first decade of life. So when people ask me, when should we be doing all these measures? I say, ideally, right from the day you're born, because there's so many prevention things. By the time, suppose you start doing these things at the age of 60, it may not work as well as when you start, say, at the age of 35. Then they say, oh, doctor, you're a killjoy, you're killing all our, chole bhature nahi kha sakte, samosa nahi kha sakte. I said, no, you can have that, but you have it in a limited measure. Not that you're having a party every day and consuming, maida stuff and fried stuff every day. So you have to kind of look at it from a lifespan perspective and not an age perspective, that there is a cutoff age beyond which you will work at brain health. Then let's move to diet. Okay, so we've talked about many things, but in diet, our diet plays a major role in many of these things. Neurodegeneration, amyloid, synaptic function, connectivity, inflammation I already talked a little about, oxidative stress and vascular damage. And that impacts brain health. Now, many people say, should we take this supplement? Should we take that supplement? What is the kind of diet which is good? So generally it's found that a Mediterranean diet is good, not just for the brain, but also the heart. So what does Mediterranean diet consist of? It consists mostly of whole foods, which are freshly made. And in the Indian conversion of this Mediterranean diet would be like taking greens, sprouts, saag, your lentils, your chole, rajma, which have very low glycemic index, will never cause diabetes. Then, of course, taking the khada food like, the whole wheat, not the wheat from which the, the chaff has been removed, or not the maida. So whole wheat, millets, these are very good for, they are the Indian counterpart of the Mediterranean diet. And something that the Indian diet, which hugely preserves the brain, which the Western diet doesn't have, is turmeric. So turmeric has been shown in experimental models of mice, as well as in humans, to reduce the amyloid beta deposition. It's hugely anti-inflammatory. Many of the spices which we consume, whether it be the simple thing like hing. How many of you all know about hing? Okay, many of you know about hing. Many youngsters, they don't know what hing is, so they'll look, what is asafoetida? They don't know what is asafoetida. So even your hing has an anti-inflammatory property. Your ginger has anti-inflammatory property. So these are missing from the classical Western Mediterranean diet. And I think our traditional food of roti, dal, sabji, dahi, and a little bit of, maybe a half a teaspoon of ghee every day, oils used, mustard oil, vegetable oil, they are very good for our Indian environment. So they have to be adopted. If you have to have non-vegetarian food, try to have fish as well as the white meat. And white meat will be chicken. Avoid red meat, which is mutton and pork and whatever. So white meat is much better. And try to adopt this. At least the base of the pyramid should be there in our diet. We think that diet is something we don't know about, but way back in olden days, if you go to the Vedas and all, and this is, it's known that we are what we eat. The Westerners are discovering it now, but we knew of it right from the very beginning, that your work, your performance is going to be directly depending on what we are eating. And there's another saying to it, is that you are what you first eat. That is what you've eaten when you're young. And sadly, youngsters nowadays are consuming more of Zomato, Swiggy. In AIIMS also, in the hostel, Swiggy, Zomato is in the wards. They come to the wards, they deliver to the doctors, they're delivering to the patients. And it's really terrible to see, because if you go back to the kitchen where they've come from, many of these labels which they put, sorry to say, I've witnessed it myself. Behind my house there is a market, so if you go there, there's a staircase which goes up, and there are all these labels, like they'll say it's a label from like Punjabi grill, but it will not be Punjabi grill. The food will be being made in that local place, and they'll put a label and they'll send it as a Zomato Punjabi grill food. So these things kind of also are happening in our circumstances. When you eat outside, you really don't know what you are eating. You don't know how adulterated it is in terms of the contents, in terms of the color, in terms of the carbs which they have. They use thickening agents. What is the thickening agent your mom will use at home to make the, paneer gravy thick? Your mom will use? Cashew nuts. Very good. A mom is answering this. She will use cashew nuts. Okay. Do you know what is the thickening agent they use in starch? They use arrowroot powder, they use starch powder or maida. They are not using cashew nuts, because cashew nuts are damn way expensive. So when you're going to order repeatedly from Zomato, Swiggy, you're going to get nice thick paneer, whatever they call it. But it's also going to be not there with your cashew, which is anyway protein, but be there with all these starchy things. And then you're wondering why you're putting on weight, and then you're wondering why we are having heart attacks. Also, the oils which they use will mostly be palm oil, whereas your mom at home will be using mostly vegetable oil, or she'll be using mustard oil. So the best way is to, learn cooking, do it at home, contribute to your mom's cooking, or get your house help to cook the way you want, rather than eating outside. I come from Bangalore, where I did my DM, and almost all gobi Manchurian there, gobi Manchurian is a big dish in Bangalore, okay, is red in color. Now, if you make gobi Manchurian at home, it's not going to be red in color, it's going to be a brown or a golden color, because they've mixed a lot of a color in it, which itself is toxic. So eating out is something which we really need to look at in terms of preserving brain health. I hope there's nobody from restaurant business here who will just wonder what I'm doing. So the other most important thing I want to talk about is dietary restriction. And this is coming up in a big way. We restrict how much we eat. Okay? We are the only species which eats when we are not hungry. Okay, there'll be somebody who will open a packet of something, we'll sit down to eat. There'll be a meeting, we'll have chai and samosa. Even I've done it. So that's why I said the disclaimer, I'm work in progress still, okay? So we are the only, but I'm hoping by repeatedly speaking this, I will restrict my eating. So if you can restrict the amount you eat to leaving 1/3 of your stomach vacant. So don't wait to eat till your stomach is full and you're burping out like one gaseous species or whatever. So keep your tummy 1/3 empty when you eat. Eat in a smaller plate, eat small portions. And this is known to reduce the reactive oxidant species, and it's known to improve synaptogenesis. It's known to improve learning and memory and causes better aging of the brain. Always check your food labels and make sure that along with the bad eating habits of ordering from Zomato and Swiggy, you do not have sedentary habits, because that itself is something. Now, also is the fact that we have a hunger hormone. How many of you all have heard of ghrelin? Ghrelin is the hunger hormone and the satiety hormone is orexin. So you have to have higher orexin levels and you have to have lower ghrelin levels to feel satiated. And the way to do that is to not have sweets. If you have too much of sweets, the ghrelin secretion is more, because it kind of blocks your receptors and you're going to be eating more. Okay, then I come to the consumption of drinks. Now, there was a time where you had these kind of advertisements where, and this is not Indian advertisement, this is of course an American advertisement. They take it till, the limits. So they were showing a young kid consuming 7-Up or whatever, Pepsi. Now, again, all the sugar drinks, all the caffeinated drinks are in the red, okay? Whereas water, coconut water is in the green. So the more you consume your diet sodas, the more you consume your sugar drinks, the more you're getting into the problem of damaging your brain by these calories as well as the contents of caffeine. How many of you will consume Red Bull? Okay, good. So Red Bull is something which has how many milligrams of caffeine? Anybody knows? A normal cup of coffee has how much caffeine? Yes? Around 30, maybe 15 to 30, depending on whether you're taking filter coffee or whether you're taking the Nescafe Gold or whatever. It's around 30, 15 to 30. But if you're consuming a Red Bull drink, which many youngsters have, to stay awake in the night and study or do whatever, they consume deadly high energy drinks. They have to the tune of 300 milligrams. That is so many times more. And what is that going to do to the system? It's going to cause confusion, brain fog. They may stay awake, but it's not going to help them retain memory, and it is also going to cause insomnia and lack of sleep, jitteriness, anxiety, palpitations. So many of the youngsters who consume this are jittery and they have a lot of anxiety and palpitations, and hence all these drinks do impact our health and our brain, and hence it's better to consume friendly drinks like coconut water and water. Then again you'll say, Madam, fir maza le liya, sab drinks fix nikal diya, no Coke, no Pepsi. But the fact is there are many colored drinks which do not have all the substances they have. You can make simple hibiscus tea at home. You can make the, Aprajita flower. You've heard of Aprajita flower? You find it growing wild. The flowers, you just infuse it in hot water and put lemon in it and put a little bit of honey. It makes a very good drink. You can have it cold, you can have it hot. So these are supposed to be more antioxidant than having colored drinks which are red or black in color. Then of course, a touch of what our herbs have, and you've heard of Brahmi. Brahmi is very good for the brain, particularly memory. For the students here who want to remember, you can have a little bit of Brahmi, but you should know the source you're getting it from in the morning to improve your memory. Haldi I've already spoken about, ginger I've spoken about. Coming to sleep. Now, sleep is something which is very, very neglected. We are all not getting enough sleep. Particularly even me as a doctor, you get called in the night and the sleep is disrupted, and I'm a very light sleeper. I don't go back to sleep. So this is something which is directly linked to brain health and cognition. How much you sleep will directly impact your language functions, your perception, your attention, your memory, and problem solving and thinking capacity. So it also impacts your metacognition. How many of you all have heard of metacognition? What is metacognition? It's a function of the frontal lobe, and nobody's heard of metacognition. Metacognition is cognition about cognition. So it is what we are thinking about, what we are going to say, how we are going to deal with the situation. We think within ourselves, isn't it? Okay, my guide has called me today. I know he's going to ask me whether I completed this task. So what is my reply going to be? The reply has to be such that it doesn't damage me, nor does it, rile the guide. So you are thinking about what you are going to say in a manner which it doesn't offend the person in front or you. So this is also a very important function of our brain, particularly the frontal lobes. Now, if you don't get enough sleep, this metacognitive process is going to go for a 6. So if you're driving on the Delhi road and you scratch somebody's car, or somebody's car scratches your car, you're either going to get up and start beating that fellow up because your metacognition has gone for a 6. You've lost the sense of proportions. Every crime has to have a sense of proportion. You can't kill somebody for scratching a car. That is a loss of sense of proportion. At the maximum, you can note their Gadi number, you can lodge a FIR, you can, claim insurance, but you can't go and start whacking him up and then trying to kill him or do something like that. Why is all this happening? It's happening because we are sleep deprived. Sleep has a huge role in the metacognitive process of thinking what we are going to do and thinking what we are going to say. It's a cognition about cognition. You have to be aware of it. That is a function of sleep. And that goes for a 6 if we are sleep deprived due to whatever reasons. There's a difference between sleep deprivation and insomnia. Many of us are sleep deprived due to the social aspects, which is being on your virtual network. I told you networking is good. Now everybody will go home and start networking. Not on the mobile, networking physically. Many of us, even when I see my residents, they have forgotten to relate face to face. They relate more on the mobile. So if face to face there's a situation, they go off the handle. But very nicely, they'll be writing very nice replies on the WhatsApp. So the physical or the face-to-face interactions we've lost control of. We don't know what we're doing. So I'd like to emphasize for all the students here, if you're sleeping well at night, it's like going to a night school. You're going to improve your memory. You're going to cause a better consolidation of your memory and recall it better. So 7 hours of sleep for students is a must. Then the impact of insomnia. Many of you will have relatives who have insomnia. So basically, insomnia can be acute or chronic. Acute means which is there with all of us. Suppose we have a stressful situation in the family, somebody's fallen sick. We may lose sleep for a few days. That's an acute insomnia. But if you're not able to sleep, you've been given an opportunity to sleep, but you're not able to sleep, despite getting an opportunity to sleep, because of whatever reasons, your predisposing factors, your perpetuating factors, your personality itself, you are doing this for more than 3 months, more than 3 nights a month. So 3 nights per week for more than 3 months. You have chronic insomnia. And chronic insomnia results in all of this. Okay? It reduces the quality of life. It causes higher absenteeism. It causes mental health disorders. It causes cognitive impairment, enhanced dementia, higher health costs, and increased accident risk. How does it cause cognitive impairment? There's a completely new channel which we as neurologists have learnt of in the past 10 years. We didn't know this existed in the brain. And that's why I say knowledge about the brain is limited. We have a channel in our brain which is known as the glymphatics. Have you heard of glymphatics? You've heard of artery? You've heard of vein? Artery pumps the fresh blood and vein takes away the impure blood. In the middle, you have the lymphatics, which is a channel which opens up only in sleep. Okay, when we sleep, the lymphatics widen. They are situated around the neurons. So they widen, and then they have a suction effect. And why do they have this suction effect? Because they suck out all the amyloid beta, all the toxins which have accumulated in the brain in sleep. If you are not going to sleep, if you're going to be insomnic and sleep deprived, the lymphatics will not dilate and they will not suck out the toxins. This is proven now, and this is strongly linked with dementia. One of the major theories of dementia now is reduced sleep as we age. So how do you improve insomnia? How do you improve your sleep? We have technologies in our system. We have Yog Nidra, which we've worked on at our institute in a very scientific way, looking at what Yog Nidra does to various stages of our brain sleep in the polysomnography. We've taught Yog Nidra. I do it myself. I'm addicted to Yog Nidra. And it has been shown to consolidate sleep. It has been shown to improve sleep. So this is something we all can do. You don't need to do cognitive behavior therapy. You don't need to rush to a psychologist. Last but not the least is exercise, and you all have a very beautiful campus, which we at AIIMS don't have. At AIIMS we have a campus, but we have dogs running after us if we try to do this, and the dogs also bite us. And recently it's not just dogs biting us, it's also the monkeys biting us. So we have monkeys and dogs in our campus, which prevent us from going around. I have not seen a monkey in this campus. I am not sure if it's there. You have it? And do they bite? Okay. So this is a common problem. We do not have safe space for walking or cycling. But ideally, any policymaker who is wanting to cut down the risk of heart attacks and wanting to cut down the risk of strokes and dementia should have designated cycling tracks, designated running tracks, just like the Western countries have. Unfortunately, we do not have safe space. My very senior own professor from AIIMS, he was in the habit of running around AIIMS and going to Green Park running in the morning. And he was doing that. He's a very famous gastroenterologist, and he got knocked down. And he had a major injury. He almost died. And some worker from AIIMS found him lying there, recognized him. He was in Green Park area, took him to hospital, immediately got operated. So please do not run around after this talk in unsafe spaces. Wherever you have safe spaces, make it a point to be mobile. They say 10,000 steps a day, but even 7,000 steps a day is enough. You can be forgiving on yourself. You can do less a particular day. You can do more a particular day. You don't have to be rigid and obsessed about it. But try to do those many steps. Try to walk. Try to do it in a safe space so that you are not going to land up with anything else. And it has been found that walking and exercising, it is the most potent contributor to the secretion of endorphins, which are the happiness hormones, and also to oxytocin, which is a happiness hormone. And you will find anybody who's depressed, if you have any depressed person or person who's experiencing negative emotions in your family, tell them to start walking for 15 minutes. Start with 15 minutes, go on to half an hour, go on to 1 hour, their depression will go away. There will be no need for antidepressant. You have to get up and go out. So this is very, very important protective factor for brain health. I want all of you IIT guys to remove these chairs and have chairs like this. Because, even in a lecture like this, we could have been exercising. There are new techniques, new chairs which can be made for each one of us in this hall. Rather than sitting, we have exercise chairs. We can sit there and exercise while we are listening to the talk, provided the speaker doesn't get disturbed with all the leg rolling. And we can also, have chairs where, I read of this article, this chair is there, you can see the pedal, the center one. He can actually charge his mobile there. So, it's a motivation for getting your mobile charged. So don't have electronic chargers, just have these chairs in the airports. And, improve. I find the best place to exercise is the airport. Because you're waiting for the flight, you have an hour, rather than go to the lounge where you will consume a number of things unnecessarily, which again have all that maida. You should just be pacing up and down in the airport because your gate is there, you know where the gate is, and you finished your 10,000 steps just waiting that 1 hour. So I think the way we way we do our day-to-day activities, whether it's in a talk, whether it's in our class, we can have improvised measures to improve our physical activities for those people who don't have time to walk, who don't have time to go around. Hence, those of you who are interested in research, there's enough research showing how the brain changes in its activity after walking by functional studies and by EEG studies. Intermittent fasting, how many of you all have heard of? So intermittent fasting is also very, very good. Don't fast for 18 hours. It's not required. So you can finish your meal at 7 p.m., which is your last meal for the day. So 7 a.m. becomes 12 hours. And you can consume your breakfast by 9 a.m. Okay, so 9 to 7 is around 14 hours. That is good enough. And that is also, intermittent fasting is also very good for neurogenesis, synaptic plasticity, and preserves brain health. Try not to have your last meal just before sleeping. It should be at least 3 hours before sleeping. Why? Because if you're eating just before sleeping, you're going to go to sleep. You may sleep, but your intestines are busy working. If your intestines are working, they are not going to be secreting insulin, glucagon, and that is where you're going to see an upsurge of diabetes. So it is well known that intermittent fasting is a good for diabetes also. The last few concluding slides, there's an impact of climate change on the brain. How many of you fight with your spouses if it's very hot? None of you? Okay, I have friends, and in my own case, I start becoming irritable if it's very hot. So excess temperature, excess heat makes you very, very irritable. Just try to look at it. Of course, now we are sitting in an air-conditioned room, but if you are in an extreme heat stress, where the temperature is 45, 46, and you're standing there like that, sweating, you become more and more short-tempered and irritable. And this is a known fact. It has been proven by studies both in animals as well as in humans. It is increasing the incidence of migraines, extreme temperatures, meningitis, seizures worsen, multiple sclerosis, myasthenia gravis, dementia, Parkinson's. All these increase with heating. Do you know what is the temperature required for the brain to get destroyed? We do thermocoagulation of the brain in seizures, where the epileptic network is. We burn those areas. We burn at 56. And we are facing temperatures of 46. So we're just 10 degrees away from coagulating our brains. Coagulating our brains means like you boil an egg. The protein in suppose you take the egg which is not boiled. The protein in that, the white substance in that is liquid, isn't it? That's how our brain is. But if you boil the egg, what happens to it? It solidifies. So that is what is coagulation of brain. At 56, the brain is going to be coagulated. So if we are having 46 today and tomorrow we're going to have 48 and then we're going to reach 50 and then we're going to go beyond that, we'll be having supercoagulated brains and our brains will be damaged. You really don't need to do anything but go on with this climate change. So basically, excessive temperatures are going to cause a brain melt, and this is something we really need to work with as a community. So I think I'll conclude by saying that brain health is very, very important for all of us. We all need our brain for doing what we have to do, for doing our research, for doing our studies, for communicating, for interacting, and preserving brain health should be the goal and should be, an ambition for each one of us. If there are any questions, particularly to any scientific aspects, the studies, I'll be glad to take them. Yes? Hearing. Okay, so this is a very, very good question. How is hearing affecting brain health? Now, what is the process of formation of memory? How will you remember something? How will you remember what happened in this hall today? Okay? You will remember through your senses. Which are the senses? The vision, the hearing, the smell, the taste, and the touch. Okay? Now, obviously, when you're listening to the talk, your touch and your smell is not playing an important role. What is playing an important role is the hearing and the vision. Now, suppose you sat in the hall. Some people were sitting in the hall with their eyes closed. Okay? But their ears were open. So whatever I said is going into their receiving cortex. Which is the receiving cortex? If the ear is open, it's the auditory cortex. So first step in formation of memory is reception. If we have to receive, we have to have functional sense organs. If you have decreased hearing, you are not going to be able to receive through the auditory pathways. You may receive through the visual pathways, but how much of information will you receive through the visual pathways? You can't hear a person through your eyes. So after reception, the information from the primary sensory cortices. So hearing goes to the auditory cortex, vision goes to the visual cortex, smell goes to the uncinate cortex, touch goes to your thalamus. So when it goes to all these areas, then it goes further, the second order neuron, it goes further to your hippocampus. In the hippocampus, you have the memory consolidation. And then it gets distributed to diffuse cortex, which is retrieval after a long period of time. So your first step of memory is impaired by impaired hearing. You're not going to form memory. If you don't form memory, you will become demented. That's why hearing and vision have to be corrected if they are low. Another reason we are not forming memory now is because we are always on the phone. If you're on the phone and what are we scrolling? We are scrolling news, or we are scrolling reels, or we are scrolling YouTube or something. I don't know what people scroll. I also scroll sometimes, sorry. But my scrolls are mostly like some spiritual realm scrolls and all. But even that is not good. Okay. So if you're continuously scrolling, you're not actually halting to register what you are scrolling. So you're not going to have a memory. 3 days later, you ask me, what were you scrolling? I will not have a memory of what I was scrolling, because I did not give it enough time to register. The same thing happens when we are multitasking. If I'm doing 5 tasks parallel, I've opened this also, at the side I'm signing something, at the side I'm dictating something, I'm multitasking. So when I'm multitasking, if I'm aging and multitasking, at 50, 60, I multitask and I'm going to just forget things. You have a capacity to multitask, say around 25 to 35 years, you know. You can multitask, you can do, that's the age you have to be a parent. Thankfully, God has given the neurons the ability to multitask when you're going to be a parent, because you can do 10 things. You can pick up the child's nappy, you can, 10 things at the same time. But the same task, if somebody asks me now you have to be a new mom at the age of 40, I'm not going to be able to multitask. So the multitasking is also an impediment to memory. And there's an age at which we can multitask, beyond which it becomes very stressful to multitask. Yes? Any other? So there's so many, I think more than 8 billion or so neurons. And each one of them is connected to the other, and there's a lot of sprouting, and there's neuronal synapses and all that. Traditionally, once you have a damage to the brain, either as a head injury or as a stroke, you are going to lose the neurons. There is no way that you can regenerate them. You can think of stem cells which are put there, but that's still in the research stage. There's no stem cell therapy per se, which is a landmark for preventing or removing Parkinson's or removing dementia. There's nothing as yet. There's stimulation, yes. Yeah, so neurons do not have the capacity to regenerate or increase in number, but they have the capacity to develop new connections. So if suppose this bunch of neurons is dead, the surrounding will kind of bypass and develop new connections. That is why we advise active rehabilitation. We advise music therapy, we advise art therapy, because these will help in the development of these new connections.
Ma'am, what's your comment on the quality of sleep versus the quantity of sleep?
So it's very important. This is a very good question. I was somewhere and I was asked, I was giving a talk and I was asked, so the Prime Minister sleeps only 4 hours, so how is he able to work so well? So each one of us requires a different amount of sleep. So how much is the sleep that you require? The amount of sleep that you get, after which you get up on your own, without needing an alarm. Once you get up, you are fresh and do not have a feeling of wanting to go back and rest for a few minutes, and do not get drowsy intermittently throughout the day. That is the amount of sleep that you require. For me, the amount of sleep is 7 hours. I know it. If I sleep less than 7 hours, the next day, I'll get up in the morning, I'll say 15 minutes or. Okay, so that is the amount of sleep you need. Now, how can you minimize that? Yoga Nidra is a very potent tool to help you minimize. And believe me, it's not just Modi, it's also Indira Gandhi who used to do Yoga Nidra. She was a practitioner of Yoga Nidra. Yoga Nidra is something which can help you reduce the amount of sleep, particularly when you're a student. So about 20 minutes of Yoga Nidra in the morning, you can do with, say, 5 hours sleep. But provided that sleep is enough, that you get up refreshed, you don't want or have the need to feel to go back to sleep, and you're not drowsy the whole day. So there are techniques by which you can reduce the amount of sleep, provided you're practicing it daily. Quality of sleep is very, very important. If your sleep is fragmented and you're getting up very frequently, you're not going to enter the deep stage of sleep. So sleep has its stages, stage 1, 2, 3, and then REM. So non-REM is 1, 2, 3, and REM. REM is responsible for encoding of emotional memory. The non-REM is for all other forms of memories, particularly non-REM stage 3. We get to 3, which is the deepest stage of sleep. From 3, it's very difficult to wake a person up. We get to that stage only after 90 minutes of being in bed. Okay? And as we age, the amount of 3 comes down. So we have to work to improve stage 3 sleep. Any other questions? No, sleep paralysis is different from insomnia. So sleep paralysis is, many of us may have experienced it once in a while in our lifetime. When we sleep, we suddenly feel, we are eyes open, and if we try to move our hands and legs, we are unable to move it. This usually lasts for a few minutes, 1 or 2 minutes, and after that we are able to move. But for those 1 or 2 minutes, it's a very scary feeling, because you feel that you got paralyzed or you are dead or something like that, except your eyes are open. Your hands and legs feel like lead. You just cannot lift them. So that has happened to many of us when we sleep. But if it occurs too frequently, every night, then it may be a form of Freste of a neurological disorder which is known as narcolepsy, which has other features also. Okay, so this is a very good question. In fact, this is a very upcoming area, even in virtual reality sets. You must be seeing many people are developing these virtual reality sets which they wear and they give it to the patient. So if the patient has a weakness, this is not a cognitive thing, it's a motor weakness. So they will give a task which they will have to do with their hands. And there is something known as mirror movement. So if they are in that VR set and they're doing the movement with this hand, even this hand will try to move. Similarly, we have another rehabilitation strategy for weakness, which is known as mirror therapy. So this is the paralyzed hand, this is the normal hand, and we put a mirror where the patient can see the normal hand, okay? And we instruct the patient, the mirror is on the side of the paralyzed hand, and we instruct the patient to do the physiotherapy by moving the normal hand. But look at the mirror. So he feels that he's actually moving the left hand, which is paralyzed, and slowly there's a flicker of movement and the movement starts coming back. That is based on this mirror therapy. Similarly, for cognitive rehabilitation, you have cognitive rehabilitation virtual reality sets now. You also have video games for cognitive rehabilitation, which are all developed by collaboration between engineers and doctors, which are available in the market and approved by FDA in the West, and in India they're coming about. So these are, tasks which you can do with colors, with shapes, to remember things. So 6 objects are given or 6 random things are given, and then those are removed. Then the person has to press which one was seen, which was not seen. When they press, when they see something which was shown in that, they press it. When they see something which was not shown in that, they don't press it. A person may be weak initially, but gradually builds up the ability to remember. So these take time, they have to be done repeatedly, and they are based on this neuronal resprouting and synaptogenesis, not the dead neurons coming back, but the other neurons taking over, which is actually known as neuronal plasticity. I don't know if you've heard that word. Even though neurons can't come back, the rest of the neurons can generate neuronal plasticity, which will help us recover. That's how technology is helping now. So schizophrenia is again a very different disease from what I see, but I will not be able to comment so much on what happens in their neural connections. There are enough number of functional studies done, there are enough number of functional MRI studies done which have shown particular areas of the brain which are showing a problem. They've been done from NIMHANS as well as from other centers. So I'm not a psychiatrist, so I will not claim to know everything about it. Yeah. Yes. Yes. So it's a very good question. So there are various forms of light. There's red light, there's blue light, there's green light, all kinds of light is there. And the brain functions in its daily activities because of light. So there's something known as a Zeitgeber. Zeitgeber means it's a clue that you have to get up in the morning. For us, what is a Zeitgeber? In India, we are a sunny country. So our Zeitgeber is the sun. Okay? But there are many other Zeitgebers in our life. One is mother ringing the temple bell in the morning for the puja. The other is, cock doing kukuruku in the morning. That's a Zeitgeber. So light is a very potent Zeitgeber to get up in the morning. Light enters through a visual pathway and goes to the hypothalamus. The hypothalamus and the pineal gland. Once the pineal gland, it enters there, there is suppression of the hormone called melatonin. And you know melatonin is a hormone which is needed for sleep. So light entrains us to our rhythm, chronorhythmicity. That is the rhythm that we have to get up in the morning and sleep in the night. In the night, if I am exposed to very bright light, okay, I am not going to be able to sleep. So that is why we have rules of sleep hygiene. The rules of sleep hygiene in people who are not getting good sleep is after 8 p.m. dim the lights to candlelight, so that the light is dim, and once the light gets dim, melatonin gets secreted. So that's the normal, for normal day-to-day sleeping and getting up. But in disorders like dementia, we use light therapy. Because there is reversal of sleep-wake cycle in dementia. There's reversal of sleep-wake cycle in stroke. When there is stroke, you will see that the patient is sleeping in the morning and getting up in the night. When there is dementia, the patient is sleeping in the morning and getting up in the night. So what is it going to do? The caregiver is going to burn out. Because caregiver has to work in the morning and the patient is awake in the night, not allowing them to sleep. So to reverse this sleep cycle reversal, which has happened in disease states like stroke and dementia, we do light therapy. So we tell them this much lux of light is needed in the morning hours in front of the dementia patient so that he gets up, and this little lux is required in the night so that he sleeps. So there's light therapy which is being used for treating people with dementia. So light has a very important role in regulating not just our normal physiology of wake and sleep, but also in disease states. Yeah, so there are studies which have said that, the blue light and red light, there are differences in the sleep as well as emotions. So that is well documented. I personally do not, we recently had a student who did research on different kind of lights and we didn't find anything. So color therapy is one form of therapy people use for lifting the mood also. So warm colors versus not so warm colors are used by many paramedical practitioners like Reiki practitioners or color therapists, where they give color, they say this color, if a patient is depressed, you expose them to this color, they will feel better. But I don't know how much scientific basis that has. I think we are done. Thank you.
Thank you, Dr. Manjiri Tripathi, for that fascinating and deeply insightful session. Your practical perspectives on the causes, management, and psychological implications of brain health has been truly eye-opening for all of us. We now open the floor for our question and answer segment. This is a wonderful opportunity to interact directly with our expert.
Question answer हो गया.
Yeah. Okay. Okay, thank you. To formally convey our appreciation, I would now request Senior Faculty Professor Varsha Singh with Dr. Yasmeen and Dr. Mahesh Sagar to do the honors to facilitate Dr. Manjiri Tripathi with a token of our gratitude and appreciation. So, ma'am, please.
Light therapy कर रहे हो आप लोग मेरे से. Thank you. Sorry, sir. I didn't put it on. I was trying to put it on.
You can have the group photograph that will come here.
Please assemble for a group photograph.